Okay, so we're going to be doing the removal of a NG tube. So first we're going to check the order for the NG removal and confirm the correct patient.
What's your name and date of birth? Cool.
Alright, now you're going to gather your equipment. You want a disposable pad, which we already have draped along his chest. You're going to want tissues, gloves, and a bag.
Tissues, got my gloves, bag.
Okay, so now you're going to wash your hands and don some gloves.
Alright.
And now you're going to prepare the patient and explain the procedure to him.
Alright, buddy. We're going to be taking this out of you today.
Okay, so now you're going to get him in semi-Fowler's position, which he's in. So we're going to place the disposable pad across the chest, already done. Give tissues to the patient so he can clean himself up. And now we're going to detach the tube, discontinue suction if that is present. We're going to flush 30 milliliters of water and then 30 milliliters of air to clear the tube.
30 ml of water. Got 30 ml of air. Do the water first.
Okay, now we're going to unpin the tube from the patient's gown, but he's still naked, so we're just going to pretend.
Nice.
Now we're going to carefully remove the tape from the patient's nose.
This might hurt a little bit, man.
Okay, now you're going to remove the tube, so you're going to instruct the patient to take a deep breath and hold.
Take a deep breath and hold.
You're going to pinch the tube with your fingers and quickly and carefully remove the tube while the patient holds his breath. Cool. So now you're going to observe the intactness of the tube. Now you're going to remove your gloves, and place them in a bag. Oh yeah, you can place the tube in the trash. You're going to offer mouth care to the patient and assist with nose blowing as needed. And since he has no arms, he'll need some help. For NG suctioning, you're going to want to measure the nasogastric drainage, remove all equipment, and dispose according to the agency policy, like for biohazard waste. Now you're going to do some documentation. You're going to want to document the removal of the tube, the patient's response, the amount of input and output, and appearance of the gastric drainage for the NG suctioning. Okay, and that is the removal of an NG tube.